Good day, everyone. My name is Grace Ogala. I bring you good news from Amazing Grace Health Center. The topic of our discussion today is diabetes and how insulin works. So let us define diabetes first. Diabetes is a chronic disease characterized by elevated blood sugar. Okay, it's usually diagnosed with an A1C of 6.5 and above. Okay, when you wake up in the morning, your fasting blood sugar should be less than 100. From 100 to 125 is pre-diabetes. Okay, above 125 is considered diabetes. Okay, so it's really easy to figure out. Okay, and there are two common types of diabetes: the type 1 diabetes and type 2 diabetes. In type 1 diabetes, the person that is diagnosed is deficient. There's deficiency of insulin in the body of that person. Usually is caused by destruction of the beta cells that make insulin in the pancreas. Okay, it's a sad situation. Most of the time, children are often diagnosed, and also adults are diagnosed too. And we really pray for the healing of such people in Jesus' name. And with the type 2 diabetes, it means that your body is resistant to insulin. Okay, the insulin cannot bring the glucose into the cells of the body. Okay, because that person is overweight or obese. That you can, easily do something about it and be a better you. All right. And I also pray for everyone with type 2 diabetes and other forms of diabetes that God will heal all of us in Jesus' name. So let us quickly discuss about how insulin works. So when we eat food, the food gets digested by the digestive system, and glucose is released into the bloodstream. Okay, and this signals the pancreas to release insulin. Okay, insulin which regulates the blood glucose in the body. And then the insulin will take the glucose out of the bloodstream into the cells of the body. Okay, the cells of the muscles, the cells of the fat, and the liver, for it to be used for energy production for the body, because the glucose is the fuel, is the gasoline for the body. All right, and also the excessive amount is stored for the raining day. So I told you the body is a very good machine if it's working the right way. So, and then if somebody is diabetic, it's a whole different story. This may not happen. All right. With people that have type 1 diabetes, they are deficient in insulin. So if they don't take the insulin prescribed by the doctor, there will be a buildup of the glucose in the bloodstream. And when you check your blood sugar, it will be so high. Okay, so you have to take your insulin if you have type 1 diabetes. So that way, that glucose can get out of your bloodstream, and the glucose can be utilized as energy for your body if you take your medications. And for people with type 2 diabetes, they are prescribed oral medications like metformin, and also some of them get weekly injectables or daily injectables. Whatever your doctor prescribed for you, please take your medications as prescribed. Okay, and also with type 2 diabetes, if you are diagnosed, please try to lose weight, because the number one risk factor, which is modified, is obesity. So lose weight. If you could lose 7 to 10% of your body weight, you're on your way to overcome diabetes. When I had diabetes in 2021, I was obese. 258 pounds. So by the time I lost about 20 to 30 pounds, I overcame diabetes. My A1C decreased to 5.4. It was 10.1 before. So that was how I overcame diabetes. And also by taking my medications, I also overcame diabetes. It goes hand in hand. You have to do everything right. So let's go over that again. Take your medications as prescribed by your doctor. Exercise, because exercise will decrease your blood sugar. And also losing weight will decrease blood sugar. Also mouth care, dental care, brushing your teeth after eating is also very important, because when you are diabetic, there's so much sugar in your mouth and it attracts bacteria to your mouth, and this causes elevated blood sugar. Okay, so by the time you brush your teeth very well, all that bacteria will go away and they cannot increase your blood sugar. All right. And also stress management is also good for decreasing blood sugar. If you are always tensed up, get worried all the time over nothing, that's not good for you, because that will just signal the stress hormones, the cortisol, the adrenaline, the growth hormones to come, and then what they do best is increasing your blood sugar. So as a diabetic, try to make yourself happy all the time, okay? Put on that smile, even though the situation does not require a smile. Because when you smile, your hormones are well balanced. And watch comedies, watch programs on TV that will make you happy. And go get some stress management things to do. Take a walk, exercise, eat a healthy snack, talk to a good friend, prayer, meditation. He can even sleep, take a nap. All right. And if it's too bad, just let your doctor know. They can refer you to counseling or to go see a psychiatrist that can prescribe you some medication. I want you to live a healthy and happy life, okay? Because it's very essential in managing diabetes. Okay, and make sure you sleep adequately. At 6 to 8 hours of sleep is very important for you. All right, and always take a day of rest. Don't walk. Even God rested. So always make sure at least you have a day to stay at home and rest and stay with your family. Okay, it's good for you and it's good for your family. All right, and also the exercise part. Make sure you exercise at least 30 minutes a day. I always advise that 7 days a week. I know they will advise you exercise 5 days a week. That's fine. But I just believe that if you eat 7 days a week, you should exercise 7 days a week. And I always advise that you exercise after eating. Okay, this is very important. Don't exercise with an empty stomach, so you don't have low blood sugar episodes. Okay. And don't forget about the foot care. Make sure you take care of your leg, your foot. As a diabetic, always wear your socks. Don't wear any tight shoe, because you don't want blisters on your leg, because that can lead to complications and which can even result in amputation of the leg. That's not a good thing at all. So take care of your foot as a diabetic, okay? And also let your doctor know if there's any issues with your leg, your foot, okay? If you are sick, let your doctor know so they can prescribe you medication, because when you are sick, it's a stress to your body, and stress is not good for your body. All right, when you are sick, your blood sugar can go up. Let your doctor know. And sometimes they can even adjust your medication. Let's quickly discuss the Somogy and the dawn effects. With the Somogy effect is when the blood sugar drops in the middle of the night, about 3 a.m. Okay, blood sugar can even drop to like 50, which is strange, right? Maybe before you slept, it was 120, and then you check your blood sugar like 3 a.m. And you're like, oh my God, 50. You'd be so scared. And then you wake up in the morning, you check your blood sugar, it's like 200. I'm like, oh my God, what's going on with me? It's just the Somogy effect and the dawn effect playing around with you. The dawn effect is caused by a surge of the stress hormone, the cortisol hormone, and the growth hormone. All right. So when you have all these fluctuations in blood sugar, please let your doctor know. And your doctor will advise you better. All right. With the somogy effect, sometimes they will ask you what kind of food you eat, and they will advise you better on the kind of food you eat to adjust your carbohydrate, protein, and fat intake. All right. For me, before I sleep, I just kind of take something before I eat a little snack. I like the yogurt, the smoothie, the Danone Greek yogurt smoothie. It's a good one. It has protein, probiotics in it. It just kind of, give me a good balance. I do very well with that. Find what is best for you. You can eat apple. Apple is good. It's healthy snack. The kind almond bar is also good. And maybe just a bowl of fresh fruits will be a good snack for you. All right. And also, when somebody is having a lot of elevated blood sugar in the morning like this, your doctor can also give you insulin pump instead of the regular insulin, because that will deliver the right amount of insulin you need at different times. Okay. And also, if you are on oral medications or not on injectables, your doctor will also adjust your medications based on your blood sugar readings. And that's why it's so important that you just monitor your blood sugar very well and document. Sometimes the doctor will say, 2 hours after dinner, check your blood sugar. And then at dinner, at bedtime, you're going to also check your blood sugar. And also in the night when you wake up, check your blood sugar. What they're actually trying to do is they want to find out the fluctuations in the blood sugar. That's why they tell you to do all of that. And don't get angry when your doctor tell you to do such things. Okay, do it. It's for your own good. All right. And do everything I advise us to do. And just do your best. Don't be afraid. People have survived this disease. It doesn't kill everybody. If you do everything you are supposed to do, you will be okay. I overcame diabetes, and I believe you can. You can do all things through Christ who strengthens you. All right? We are healed in Jesus' name. And I thank you all so much for celebrating my birthday with me. So many birthday wishes. I love you all so much. Thank you so much. And please don't forget to follow me on the social media outlets. Please, if you have a question for me, in the comment section, leave a question. You can text me. You can email me. You can send me messages on Messenger. Until we meet again, it's goodbye for now.